Hello, and welcome to Next Generation Behavioral Health.
10-minute tips for modernizing patient care.
I'm Dr. Christina Armstrong.
And I'm Dr. Julie Kin. We work in the Department of Defense, helping put out mobile apps, websites, and other health IT for our nation's service members, veterans, their families, and their providers.
And we also train providers on how to use this technology.
We hear a lot of questions, and in this podcast, we try to answer them, and we do it in 10 minutes or you get your money back.
That's right. In our last episode, we talked about the research behind mobile applications. And we realized, is that the end of the mobile app research story?
No way.
No way. There's so much more. We wanted to give some examples of some of the research that has recently come out. So, where shall we begin, Julie?
Well, why don't we start with the PTSD Coach? Because this is one of the oldest apps that have existed in the DoD and VA mobile app sphere. Mobile app sphere, but I guess I kind of like mobile app sphere. It sounds like atmosphere. Anyway, the PTSD Coach is an app that has practical guidance for how to cope with PTSD symptoms. It also teaches about post-traumatic stress and post-traumatic stress disorder, gives opportunities to learn, engage, and ways for self-care. It was initially developed by the National Center for PTSD along with help from T2, and it's a nice, solid app, not just for service members and veterans with PTSD, but also for their family members, providers, and civilians who might have post-traumatic stress.
The team at the VA, also a team at Stanford, recently published a randomized controlled trial, the results of an RCT, comparing the use of PTSD Coach in clinical care compared to a waitlist condition. The use of the PTSD Coach, the participants that used it had significantly greater improvements in PTSD symptoms, depression symptoms, and psychosocial functioning.
Okay, correct me if I'm wrong. So the folks who used this app versus just nothing seem to have better coping skills at the end of the day. The app did seem to help. It wasn't just a waste of time and money.
Absolutely, yeah. And the results were significant. Yeah, they could cope better with their symptoms. They had lower depression symptoms and lower PTSD symptoms when compared with not using anything at all. And considering the reach and availability of apps that are free and available like the DoD and VA ones, that's significant. That's an important available resource for anybody that might be struggling with these issues.
Yeah, I was pretty surprised to see the depressive symptoms also be significant. I wasn't expecting that at all, but it makes sense because PTS symptoms and depression are comorbid or co-occurring, to use better terminology there. So it makes sense when you think about it. But still, it's nice to see this data because it shows us that when we take these evidence-based methods and put them in a mobile app, it still works.
So this is just a really well done study and is exactly a good model of taking what we think is true about well-designed mobile apps and then actually putting in the work to do an RCT, which takes years and years to do. It's really a great thing to see this level of research coming out.
Yeah, and we'll put the link in our show notes, as always.
Absolutely. So there's another recently published RCT that I'd like to talk about as well. I think it also serves as a really good example of how to do a really high quality study with a mobile health app. And that's with Virtual Hope Box. Do you want to tell us a little bit about Virtual Hope Box?
Yes. Our listeners are probably a little sick of hearing us talk about this app because again, we've mentioned it in, I think, every single episode, but it's a good, solid app. It's one that is just very colorful, but it's an electronic version of the traditional Hope boxes that we use in cognitive therapy for folks who are at higher risk of suicide, depression, self-harm. And the original version was just a shoebox that we'd fill with pictures and cassette tapes of relaxation exercises and maybe notes from your children and things that were reminders for living or reminders to help uplift your mood. And so Dr. Bush, who wrote this RCT along with his colleagues, and he's one of our colleagues, collaborated with the VA again to get a grant and develop an electronic version of the traditional Hope Box. That's why it's called the Virtual Hope Box. And included in that grant was a pilot study and this randomized control trial. And what the app does is, everything I said before. It gives you a space to show pictures, can link to your favorite YouTube videos of pandas, you can include your favorite music tracks, but it also has breathing and relaxation, distracting games, coping cards, and contacts for emergencies, and a lot more too.
And the RCT that came out just in also very recently, 2017, it was just a really well-designed RCT. So they had 118 participants in this study, and the results showed that the Virtual Hope Box users reported significantly greater ability to cope with unpleasant emotions and thoughts compared to a control group. So this one was a little bit of a different design. It was again an RCT like the PTSD coach RCT, but now they were comparing the use of the Virtual Hope Box with treatment as usual. So, and they actually did a enhanced treatment as usual condition. So they were comparing it to people that were receiving some other care, but not care with an app. And they did see those significant results for coping with negative emotions. And so that's great because that's exactly what the intent of the app is. But it's really especially vindication that an RCT can be done well with a mobile health app.
Right. We don't expect to see randomized control trials for every single health app that comes out. It would be impractical, and by the time we published the studies, the apps would be useless. But
Exactly.
It still should happen once in a while, especially on seminal apps like Virtual Hope Box, PTSD Coach, and similar ones, because then we can take those findings and extrapolate it and say, yeah, we'll use evidence-based approaches in these mobile applications, and it works when you do it this way. Maybe this other way doesn't work quite as well. Let's tweak it. But in addition to RCTs, we need to keep doing usability studies, efficacy studies in labs, and other kinds of trials to help make sure that we're delivering the best resources.
That's right. And if you've heard the last 2 research episodes and you are just saying, I need more of this information, this is so cool. Julie and I recently published an article in Best Practices for Mental Health, and it's about how to evaluate the evidence base for mobile health in behavioral health care. And so I highly recommend it because it really goes into detail about the evidence space for mobile health and really how to, as a clinician providing care to patients, how do I really evaluate this in a reasonable way and not for people that are just researchers and doing this all the time. We want to make it really practical for you.
We'll put the link to that in the show notes as well, along with the Bush et al. Study on Virtual Hope Box. But yeah, keep us posted. What other questions do you have about effectiveness for these applications? Do you feel like what we've discussed here is enough to make you feel confident in using these or not? That's something that we really want to be working on over the next few years as a mobile health community.
Thank you so much for joining us on Next Generation Behavioral Health. Please let us know new health technologies that are exciting to you and how we can support mobile health integration in your care.
You can connect with us on Facebook and Twitter at Military Health and learn about our other mobile apps, websites, and podcasts like A Better Night's Sleep and the Military Meditation Coach. Thank you so much for subscribing and rating us on iTunes or wherever you get podcasts. Next Generation Behavioral Health is produced by the Defense Health Agency.